Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your community-owned hospital. This program features healthcare services and programs we have here at KRMC that I think will be of interest for you and your family. So I've got a great guest for the show today, so I hope you'll join us. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is David White. He's the director of our critical care. Dave, thanks for being on the show. So, critical care, that's like the most serious of serious patients of the whole hospital. That's the...
It is. We deal in a lot of the emergency patients, surgical patients, some of the patients within the facility. The nurses who care for these patients are definitely the elite in the hospital.
Right, right. So. And there's two different departments, ICU and PCU, right?
That's correct. The ICU, exactly what it is, critical care department, and the PCU is a step-down department. It's a 24-bed unit staffed by, again, the elite in nursing staff.
Right. So what does PCU stand for?
Progressive Care Unit.
Progressive Care.
It's a transitional area for the patients coming from ICU, perhaps going home or to a med-surg floor.
Okay, so it's kind of the progression of going towards the outdoor.
Right, that's right. Closer to the front door.
Right, so ICU, obviously that's the super critical patients that, like you said, have had surgeries, but then they're like all the monitors and everything that they're hooked up to 24/7. And
oh yeah, some of those patients, you can walk by their rooms and it looks like something out of a science fiction story.
With all the things coming up.
Right. Yeah. So
how did you get into ICU?
It all started a long time ago. My parents actually were both nurses,
and I didn't know that.
My mom was a critical care nurse, and I guess I was destined
that
to be a critical care nurse.
Okay.
I started in '93 and worked my way up, and my specialty in the critical care area was surgical ICU and cardiovascular ICU.
Oh, okay, okay. So where's home? Where did that start?
Ottawa, Canada, actually,
oh.
is where I went to school. I was an old diploma nurse, and the sisters ran this program, so I can make a bed like nobody else can.
One like you can drop a quarter out or whatever they used to say.
And we immigrated to the United States in '98 and started in a surgical cardiovascular ICU in Victoria, Texas, which was my first area.
Okay, okay, very good. So you brought your family with you here to Kingman. How long have you been here?
3 years this July, actually. Yeah, it's been wonderful.
Very good. And how big's the family? What have you got?
One wife, one daughter.
Oh, just I was thinking you had more than one child.
No,
okay.
14-year-old daughter. Actually.
Oh, very good. Like, boy, she's 14 already. I just remember meeting her when you first moved here, and she was still little, and now she's growing up way too fast.
She's wonderful. She really is. She'll be going to high school next year at the new Lee Williams High School.
Oh, very good.
And she got accepted into the Cambridge program.
Oh, excellent. So I've heard some really good things about that
really
program.
Proud of her.
I bet you are. Well, and I know we can talk more about that too, because she's done some other pretty cool things. She had that whole idea for the daddy-daughter dance.
She did. When we lived in Texas, we frequented a yearly daddy-daughter dance, and she was disappointed that it didn't happen here in Kingman. So she approached the Rotary Club, and they ran with the idea, and we had a successful daddy-daughter dance in March of 2012.
I've heard talked to a couple of different daddies and daughters who went and just had a great time.
Really good time, and I expect it to be double the amount of people next year.
I was going to say, and I think it's probably going to become another annual event. Yeah. It's one of those great things.
I hope so.
Well, it's one of those great ideas, and sometimes it just takes someone like your daughter to get the seed planted and water it and kind of push it.
That's right.
Make it happen. And she did that. That's awesome.
And she'll be volunteering at the hospital as well.
Oh, very good. So you think you got another one following?
I think so. She
family traditions?
Yeah, she's told us that she'd like to be a nurse.
Oh, very good. Excellent. So you've started with the surgical cardiovascular, and now you're a director of the full department. So
I loved bedside nursing. What I found what was missing in nursing was good leadership, and I took it upon myself to change the world, I guess.
Yeah, very good.
And went back to school for my bachelor's and my master's, and have taken up leadership now for about 8 or 9 years.
Very good.
And I love it. I love it.
That's good. Well, I know we're blessed to have you
Thank
here.
you.
You made some big changes up there, and it's awesome.
Yeah.
It shows.
Thank
and
you.
I hear that in our patient sat numbers and all of that.
Mhm.
It shows.
Mhm.
You know, and
Definitely.
we've talked on the show before. We've had others on the program. We've talked about the difference in the culture when the people are passionate and
Mhm.
care, and that we're pretty blessed at KRMC to have that kind of a team.
Definitely. I mean,
Mhm.
I surround myself with the best people, and
Mhm.
they make me look good.
That's what it's all about.
That's right.
I know.
That's
That's with my team too.
I couldn't do what
Everybody.
I do without them. you
That's
know, they're
great.
wonderful,
That's
so.
great.
Mhm.
So, are there plans? I know we're working on putting new faces in some of the rooms as far as remodeling, trying to get it a little bit of an upgrade. Because I think third floor is like, or that section is one of the oldest parts of KRMC, the first
Right.
original part of the hospital.
Right, and there's talk about doing some remodeling at this point in time, but I think where we're at, I mean, we're full continuously.
Right. I was
don't
gonna
know
say
if that's a good thing or a bad thing with
I
the sickness of the
know.
people, but we do still have the state-of-the-art equipment and state-of-the-art physicians as well. So.
Mhm. It is difficult. I was thinking about that to do any kind of a remodel because you have to close up rooms.
Right.
And ICU, because it is so, everything is right there
Right.
that you need, and it's not like you could roll it down the hall to a
Right.
different part of the hospital.
It's tough to close down rooms or
Right.
close down sections of a
Unless
critical
you got
care
people,
unit.
everybody to agree. No one's allowed to get sick for the next 10 days.
That's right. That's right.
And then we're going to quick remodel, then you can get sick.
A magic pill.
Yeah, yeah. If we had one of those, we'd be
Mhm.
rich. Yeah. So that is a challenge, but I know that the rest of the hospital too. They've been doing quite a bit to remodel
Mhm.
and give a fresh new look. And
Mhm.
it's
A lot of
it's been-
painting going on, cleaning up. It looks nice.
It
looks
does.
really, really
yeah,
nice.
yeah. I like just it's warmer colors and feels good.
Mhm.
I think again when we go back to talking about ICU, and of course that's one of the scariest things for both the patient and family when someone's in that critical of care
Right.
or need and they have to be in the ICU. And I think another thing that I've heard is the great communication that you and your staff have put in place with family members, with the doctor, making sure they're
Right. That's key in critical care. Our physicians are wonderful. Dr. Wynn and Dr. Matheny are great in talking with the families. The nurses as well. They keep the families informed, everything that they're doing, either during visiting times or by phone. We have interdisciplinary rounds every day at 9 o'clock in the morning, which incorporates respiratory, physical therapy, dietary, and I hope I didn't miss anybody else, but pharmacy.
yeah.
And the communication for each and individual patient is wonderful. So we know the plan for these patients. We know where we're going with these patients. And again, all that information is given to the family members as well. We provide them with information packets, phone numbers, visiting times, rules and regulations of the critical care unit. Unfortunately, we can't have real flowers in the rooms,
Yeah,
those kind
right.
of things.
Yeah.
So that's key. Communication is definitely key.
Okay. And it's and I think that helps reassure the family
Right.
that they're getting the word so they know what's happening.
Right.
And as we said, it's scary for both sides involved.
Right,
So
and the staff are genuine. I mean, they're caring, their compassion for their patients and for their families.
It shows.
It does.
It does.
It really, really does.
Yeah, and then PCU again. We talked about how that's the next step.
Right.
Oh, so that's a good thing. If someone moves from ICU to PCU, that's a
Right.
big thing, a big step.
It is a big step, and the PCU nurses are phenomenal in their own. They'll take these ICU patients, these step-down ICU patients, and just finish the rehabilitation or the medicines and everything else to get them better. And they're just incredible. The PCU team is wonderful.
That's
The teamwork is incredible.
That's
So,
good.
Yeah.
Well, and it's important again, I would think, because if usually someone's in ICU for a while, right?
Sometimes, yeah.
And so then, you haven't been using your muscles and things that probably aren't working quite like they were
Right.
before you got sick. So
Right.
that's
And we
part
have
of
a
that.
great physical therapy department. They come in, they help out. They'll work with the nursing staff to help with the patient's range of motion, keep their strength up, and what have you. So
Yeah, because that is that whole team approach again.
That's
and what
exactly
you were
right.
talking earlier about that interdisciplinary team, and it is that. I mean, it's not just one section that makes that
Right.
patient well. It's
Right.
the whole team together. They all play an important role.
that's right.
in
And
getting well.
what's amazing about it is the physicians encourage the interdisciplinary team on their recommendations, on their views, everything else.
Cool.
Yeah, definitely.
So how, I had Bob Zarnecki on the show not too long ago. We were talking about the EMR and what that's going to mean, and that the hospital side, of course, is going to be hopefully going live in a few more months.
Right.
That's a big.
It's pretty exciting. I've been fortunate enough to be a player involved in the designing of the EMR. It's a big implementation,
Right.
and I think it'll be a big difference for the nurses who have only done paper charting. But I see this as a huge benefit for our facility, and I believe that the nurses will pick it up really quite rapidly. So.
Well, it takes a while. In fact, Bob and I were talking about how I remembered back in the old days going from typewriters to computers,
Right.
and what a horrible, I mean, I went home every day with a headache for like a month trying to figure it all out. And then all of a sudden, it just one day the light came on and things all kind of fell into place. I was
Right.
like, oh, and I would never go back to a typewriter again, right?
No.
So, and that's how I think it's going to be with the EMR. It's
I
that
think
transition.
That's right. The
Gonna be
transition's
tough.
huge, but Bob's team has been amazing. They have worked with the nursing staff, worked with the nursing directors to give us what we need, what will help the workflow with the nurses. And they've bent over backwards for us. Size of screens, positioning of where the computers are going to be, everything. They've taken it down to the wire, so they've been really good.
So that
Yeah.
part should roll pretty smoothly.
Oh, definitely. Kudos to Bob and his team.
Right,
They worked hard.
Yeah, it's
Definitely.
a huge project, and we talked about that. Truthfully, it even went back to 4 or 5 years ago when we first started doing the Operation ID, because it was really like one of the first steps, because you got to make sure you have the right patient,
Right.
that you're giving the right meds, so that you're putting the right into the right file.
That's right.
Electronically.
And all the puzzle pieces are coming together.
Yes,
You know,
it's
so it
pretty
should be-
exciting.
It is
actually,
exciting, actually.
and it's a big thing for KRMC. I mean, I think we're one of the first in our area for
Right.
sure. I mean,
Yeah.
for a small rural community to have this kind of a system in place.
The nurses have embraced it. There hasn't been any
Oh,
negativity
that's
about
good.
it. They're eager.
Yeah,
I
good.
think they're a little nervous, but they're
yeah,
eager.
well, good. Well, we can talk a little bit more about that. We're going to take a quick break,
Mm-hmm.
and then we'll be back. So stay tuned, and we'll learn more about how that EMR is impacting your patient visits to KRMC. Welcome back to Your Health Matters. My guest today is David White. Dave, thanks for being on the show again.
You're welcome, Jamie.
David is the director of ICU, PCU, critical care. It's okay. So how does a person end up in ICU or PCU?
Majority of our admissions into the critical care area, or the ICU, comes from the emergency room,
Okay.
unfortunately. Due to the severity of the patient's vital signs, their diagnoses, something along those lines, puts them in the critical care area. Could be a motor vehicle accident.
Okay.
Could be a need for surgery, emergent surgery, something along those
Okay.
lines. We'll
Heart
put them in there.
attacks,
Heart
strokes,
attacks,
those kind of things that-
Exactly.
So you're the kind of first line of defense when someone comes in super sick. You're the ones that get them stable,
Right.
starting that healing process.
Exactly.
And then move them to PCU and then hopefully out the door.
Exactly.
Feet first.
Mhm.
Yeah, I mean standing upright. Right?
Standing upright.
Right, that's a good thing. I think it's important for people to realize that, number one, of course, our ER department is always working on improving and changing, and we've gone from a level 4 to level 3.
We're working on the level 3. We're almost there. Yeah.
And as a trauma center, which means they've got a team in place that's able to deal with more serious injuries, health issues that in the past, a lot of times we had to medevac them out.
Right, right.
So more and more we're able to keep those serious patients here.
Right. We have a
And,
great emergency crew. They do a great job down in the emergency room, getting that patient ready for critical care, and then bringing them up to us. And we have great ICU doctors, we have great surgeons, other consultations of doctors, infectious disease, our cardiologists are wonderful.
And then, of course, we have our Mayo affiliation, which allows us to have them as a network as well, which is huge, of course, and adds that whole other dimension to what we're doing. And we were talking earlier about that electronic medical records, the EMR.
Right.
And you were talking about the nurses, that they're actually getting ready and kind of gearing up, and they're excited about all that. What is that going to mean for our patients to have that EMR in place?
I truly believe that having that EMR will help with readmissions, quickly getting that information to the staff, not having to leaf through paper anymore. Filed in the computers, it's just so much easier. For the physicians to access information, patient information, is so much quicker. For the nurses to document, so much quicker. Their workflow will be so much quicker.
Oh, that's good.
Less paperwork means more time at the patient bedside.
Right,
So.
right. Well, and so all the results are going to be there faster too, right? I mean, like lab work, x-rays, all of those things that are from the various departments, all are going to be input and available right on the screens for the docs, so they're going to be able to better diagnose quicker.
Exactly. And I mean, the number one thing for us is patient care and patient safety.
Right.
And the EMR will enhance both those things
That's
for us.
great. Yeah. So it's, people, again, to help allay people's fears. I mean, let's face it, even though we all work in healthcare, healthcare's scary. Being in the hospital is scary. And most people, that's the last place you want to be.
Right. I remember my days as a student nurse, and I questioned if that's exactly what I wanted to do, having somebody's life in my hands. But the support of senior nursing, mentoring through the years, physicians, has really helped, in the nursing field. But I wouldn't trade it for the world.
That's great. That's great. Well, and I think there's something too to be said of working in a community like Kingman, the size of Kingman. I have many times pointed out to co-workers and stuff that when you work in a community this size, you have to provide the very best patient care, because that person you're caring for right now, you might run into at Walmart or Safeway next week, and they're going to be in your face if you didn't take care of them well.
That's true.
And we see our friends and neighbors and relatives are those that we're caring for here.
The nurses here, and I'm not just talking ICU and PCU, but all of the nurses in KRMC are just so genuine. They truly care. It's not just a job for them.
Right.
They do this genuinely because they care. So, and it shows. It really, truly shows.
Yeah. I think, I've been here almost 9 years now, and I've seen the growth, and as we've, kind of continued to hire the right people, bring the right teams together. And I mean, to be honest, the hospital didn't have such a good reputation back in the old days. I mean, and there's still some of those folks that were around 20, 30 years ago that think of KRMC in that same light, and they don't realize the steps we've taken, the cutting edge technology we have here that most hospitals would give their eye teeth for to begin with. The staff that they've brought in, the new doctors that we have, our Mayo trained radiologists diagnosing. I mean, it's pretty amazing.
It's top level. It's just top level in all aspects.
So is that kind of one of the things that helped encourage to bring you here?
It did. Leaving Texas was difficult for us. I enjoyed the hospitals that I worked in. When I came to Kingman, I was overly impressed with the level of care that they had here. I was impressed with the administrative staff of this hospital, how supportive they are towards healthcare and towards nursing. How supportive our CNO was towards nursing. I think she would bend over backwards for us. And then the staff, meeting the staff and knowing that they truly enjoy working at this facility. And that really attracted me to coming here.
That's good. So I'm glad you're here.
Thank you, Jamie. I like being here.
That's good. That's good. So what kind of things do you and your family get to do when you do get a day off? I mean, I know you have to work some crazy hours.
Sometimes some longer hours,
Yeah.
but I have a wonderful staff, like I mentioned, and they just make me look good. So, camping, we love to camp.
Oh, and there's lots of good places
Arizona's
for
a
that.
great state to
Yeah,
go camping.
there is.
Texas, not so much, but Arizona's a great state. We also ride our Harley Davidsons. We love riding, my wife and I, and just spending time with the
Yeah,
family.
that's good.
So.
Yeah, we got some good things to do in Kingman,
Mhm.
and I think, again, I'm fortunate that the people I've had on my show too have all been able to share that they've really liked being in Kingman, and again, I think that's the other thing that we're doing is hiring people who want to be here.
Right,
Yeah.
right. And there's always something going on, at least once a week here in Kingman. There's always something going on.
It's amazing.
Mhm.
Scott and I have talked about that on the show a couple of times of people that say, oh, there's nothing to do in Kingman. I'm like, do you want my calendar? You got to get off the couch.
Right.
But there is always
There's a lot of
something
things.
to do in Kingman.
And it's so close to everything, too.
Right. Yeah.
I appreciate that. I love the fact how close it is to Vegas and Flagstaff and even California. So,
Yeah, you get to the ocean in 5 hours and
That's right.
be back on Monday, go to
That's
work. The best of both. You
That's
can
right.
drive up in the mountain, play in the snow, and come back down and warm up.
Yep,
That's my idea of a perfect winter.
it is.
Did you have snow? What part of Texas were you
We were in
in?
South Texas, right on the
Oh.
beach, so
Oh,
near
so-
Galveston
Oh.
and Houston area, and we did. I remember getting snow one year, and it was the first time it snowed in that area in over 100 years. So the children were
Everything's-
out all day just
Yeah.
playing in the snow, but it melted quickly. So
Well, yes, I was going to say it probably shut the whole city down.
It pretty
'cause
much
you don't
did.
have
Yeah.
anything to deal with that kind of stuff.
No.
So, I lived in Dallas for a year as a child, and I remember they had it was like a half inch of snow. And my brothers and I from Minnesota, of course, we're just like, there's not even enough here to make a snowman, little snowball. And the whole city shuts down. We had
Shut
snow
down.
days, and we're like, seriously?
it's amazing. We can live through a hurricane, but when it snows, it shuts down.
So we're drier here too. That's
a
another
lot drier.
advantage.
A lot drier.
Yeah,
Very
we don't have
humid
that
in the Houston area. Yeah.
And no hurricanes. That's
No
a good
hurricanes.
Thing. Get the winds once in a while, but it's
They're
not
nothing.
So bad.
They're
Yeah.
nothing. Absolutely. And monsoons. I learned about monsoons. I think it was last year, and I kind of laughed at them when they
Yes.
came through because it's a big word for that.
A little bit
and
of
it's not
rain.
really a hurricane. Yeah.
I know.
So
It's all perspective, I think,
Yeah.
is what it comes
Yeah.
down to. So, are there any other exciting things that are coming up besides the EMR that?
that's the biggest thing.
Yeah.
That's huge.
Yeah.
And
It's a big
having,
investment, too.
It is. Having all the nurses in KRMC trained on this is a huge undertaking right now. But the nursing directors are working together and closely with our CNO and with the IT department. I think we got it covered.
Good.
So-
Well, I forgot I was going to talk about this with you a little bit too. With that EMR, what's nice with that is then when the patient is discharged, when they get well enough to leave ICU and then PCU and go home,
Mm-hmm.
they've got that, their physician is going to have that record as well, access
Right.
to that. So they'll know everything that was done to them while
Mm-hmm.
they're in the hospital, if there's changes in meds or
Right.
things like that. And that's going to be a huge improvement for them as well.
Massive. I mean, the
Yeah.
electronic record is just, it's not anything of the future anymore. It's here, it's
here,
now, and it
right.
needs to be done.
Yeah,
So.
yeah. And we talked about with Bob how, again, we get so many people here, like in the winter, that are here, snowbirds as we call them, that come to warm
Canadians.
up. Yeah, the Canadians and the Minnesotans that come
Right.
to get warmer. And they'll too, if they need health care while they're here, then they'll have that record to be able to bring back with
Right.
versus a accordion file full of papers and kind of
Papers and
sort it
right.
all through.
Yeah.
So that's, it is, I remember it's something that people have talked about for years, but it is here. And I'm very proud of KRMC and the fact that we've put that in place, made it happen.
Our technology in ICU is improving every day as well. Dr. Wynn and Dr. Matheny encouraging the nursing staff for ultrasound, bringing in bronchoscopy towers, just making things happen in the ICU as opposed to sending them out in different places, keeping that care right there in the critical care,
Awesome.
which is increasing the knowledge base for the nurses, the education for the nurses, and
Super.
it's a wonderful thing for our patients.
Well, I
It really
think
is.
people can rest assured they're in good hands if they do need to come to the ICU or PCU. I'm glad you joined us today. It's been great having David on the show.
Thanks.
I hope you'll join me again next week. I'll have another great guest on the program for you.
Bye.